More parents in the U.S. are choosing to not vaccinate their children.
Emotional or psychological stress also increases aging.
A deep dive into why and when hair starts to go gray.
She's an angel on earth.
And a selfless surrogate helps a Tennessee woman finally become a mother. Welcome to Eye on Health, where we focus on stories that affect your physical and mental well-being. I'm Bradley Blackburn. We start with public health headlines from Washington.
So help me God.
Congratulations, Mr. Secretary.
In the Oval Office Thursday, Robert F. Kennedy Jr. was sworn in as the Secretary of the U.S. Department of Health and Human Services, and he thanked President Trump, who was promised to let him, quote, go wild on health.
I genuinely believe that you are a pivotal historical figure, and you are going to transform this country.
Confirmation is confirmed.
Earlier, the Senate confirmed the vocal vaccine skeptic in a 52-48 vote. There was only one Republican no vote, from Kentucky Senator Mitch McConnell, who had polio as a child. In a statement, he said, "In my lifetime, I've watched vaccines save millions of lives from devastating diseases. I will not condone the relitigation of proven cures." Kennedy now controls vaccine recommendations, food safety, health insurance programs for roughly half of Americans, and $1.7 trillion in federal spending. A federal judge in Maryland has paused Trump's executive order aimed at restricting gender-affirming care for transgender children. The ruling followed a lawsuit filed earlier by families and doctors of transgender and non-binary children. The ruling is in effect through the end of February. Federal health agencies have restored several web pages and data sets following a judge's order. The data had been removed from public access to comply with a presidential executive order to take down any websites that promote gender ideology.
We will comply with the law in the courts, but we will also continue to seek every legal remedy to ultimately overturn these radical injunctions and ensure President Trump's policies can be enacted.
A federal judge has temporarily blocked a new Trump administration policy that would cap indirect costs to medical research at universities, medical schools, and research hospitals. On CBS Evening News Plus, medical contributor Dr. Celine Gounder explained what the cuts could do.
You probably will see a delayed effect in terms of the science itself, but it's all of the people that are employed by academic medical centers, not just scientists, but it's the security guards, it's the janitors, it's the folks in IT support. And in some communities, places like Durham, Indianapolis, Cleveland, where the academic medical centers are the primary employer, those communities could be hit very hard.
And the Food and Drug Administration has paused public health efforts started during the Biden administration, including a proposed ban to formaldehyde in hair straightening products, a proposed ban on menthol cigarettes, and the proposed addition of front-facing nutrition labels to packaged food. Flu cases are surging in the U.S. For the first time in years, the CDC has declared this season high severity. The last season that happened was the 2017-2018 season. Federal health officials say flu hospitalizations are now higher than any peak week on record since the swine flu pandemic back in 2009. Flu deaths have topped COVID deaths nationwide. The two strains showing up are H3N2 and H1N1, which are both covered in this year's vaccine. About 40% of adults have gotten the vaccine, which is 10 percentage points lower than the season before the pandemic. Since the flu season can extend into May, doctors say it's not too late to get the vaccine.
They're not 100% at preventing infections, but more importantly, they prevent really bad outcomes like hospitalizations or deaths.
There are antiviral medications available like Tamiflu that can shorten the course of the illness, but doctors say they should be started soon after symptoms appear to be most effective. The current bird flu outbreak in humans could be bigger than we realize, according to the CDC. A blood test survey of 150 veterinarians who treat cows found 3 had antibodies for H5N1, but had shown no signs of sickness. Federal health officials have also confirmed a dairy worker in Nevada contracted a different strain of bird flu, D1.1. That illness was considered mild. D1.1 is the predominant strain of bird flu in wild birds and poultry, and new data from the CDC finds 15 people in 5 states contracted bird flu from exposure to poultry last year. That same strain also killed a person in Louisiana. This is the first time a D1.1 infection has been traced to a cow, but it's the second strain that is transferred from birds to cattle.
Right now, we know that this is now circulating in cows and it's not just going away, and there's new strains coming in. And that's dangerous because you have a mammal that lots of people are hanging out around, which now can transfer over new mutant strains to humans. So I think we're in a moderate risk scenario. I still think until we see it get more virulent and until you see human-to-human transmission, it's something to monitor but not to panic about.
The CDC confirms there is no evidence of human-to-human transmission of bird flu, and the health risk to the public remains low. The CDC is also reporting at least a dozen people died from whooping cough last year, the most deaths from the bacterial infection since 2017. Cases of whooping cough, also known as pertussis, have also surged since the start of this year. Florida is reporting the most cases, and the majority are children under 5 years old. Young kids are the most vulnerable. Health officials recommend children between 2 months and 6 years old get vaccinated and then get another round around age 11. The CDC also recommends pregnant women get vaccinated again to boost their immunity. Health officials in western Texas are trying to contain a measles outbreak among people who are unvaccinated. At least 24 people have been diagnosed in the last 2 weeks. Most are school-aged children. At least 9 have been hospitalized. A team from University Medical Center is traveling through Gaines County, Texas in a mobile intensive care unit. They wear head-to-toe protective gear while interacting with patients. Measles is one of the most contagious diseases, and public health officials expect to see more cases. Gaines County has the highest rates of vaccine exemptions in the state.
He woke up with some spots, as you can see, on his cheeks, and we just wanted to make sure that if it is the measles, that we get it treated properly.
Nationwide, the CDC reports there were 16 measles outbreaks last year, and there were 4 times the number of cases compared to 2023. Nearly 90% of the cases were in unvaccinated people. The measles outbreak in Texas is the latest reemergence of a disease that had been virtually eliminated in the U.S., and it comes as vaccination rates are declining. CBS's Manuel Bojorquez takes an in-depth look at how refusing a shot can have broad impact.
Tampa area mom Tiffany Vargas says her 8-year-old daughter, who she asked not be identified, has not received childhood vaccines.
So no measles, no chicken pox,
nothing.
No polio.
Nothing.
And why is that?
Well, I started doing research, and I saw that a lot of doctors were just having a really hard time answering the questions that I had.
Her questions go beyond long-established safety studies to whether there's enough transparency from the medical community on possible side effects. Her research, she says, includes reading vaccine warning labels and looking into their ingredients.
We're not anti-vaccines. We just want our questions answered.
In Florida, parents like Vargas can opt out of vaccinating their children using a religious exemption, which is one reason Vargas moved her family out of New York.
I saw that this was going to be an issue, that I wouldn't be able to exercise my right as a parent to choose what would be best for my child.
The vaccination rate for Florida kindergartners has fallen to 88.1%, the lowest in decades. Nationwide, at least 10 states have also seen some vaccination rates fall.
90% is not anywhere near good enough.
Dr. Jeffrey Goldhagen is a pediatrician and professor at the University of Florida.
What does it mean if these rates continue to go down?
It means increased numbers of children infected. It means epidemics of measles. We are at great risk for the reemergence of polio in this country.
While the vast majority of medical organizations say childhood vaccines are safe and effective, it's not enough for parents like Tiffany Vargas.
So is it safe to say that you're more concerned about possible side effects from a vaccine than you are her possibly getting measles or polio or something like that?
100%.
She's as convinced in her approach as most doctors are about theirs. Manuel Bojorquez, CBS News, Tampa.
There's new hope for kids with peanut allergies. A study by the National Institutes of Health found children with allergies who gradually ate increasing amounts of peanut butter over 18 months could eventually eat 3 full tablespoons without an allergic reaction. This method worked for 100% of the kids in the study, but the treatment should only be done under the supervision of a doctor. The global chemical maker Bayer is behind new legislation introduced in at least 8 states that would shield the company from lawsuits alleging its weed killer Roundup causes cancer. Opponents of a bill in Iowa showed up for a rally at the state capitol building this past week. The bill would shield Bayer from claims that it failed to warn about cancer, so long as its labels on Roundup weed killer follow guidelines from the Environmental Protection Agency. Bayer disputes the cancer claims, and the EPA has said Roundup is not likely to be carcinogenic to humans when used as directed. February is American Heart Month, and doctors say it's important to understand how heart health is connected to brain health. While the brain is just 2% of the body's weight, it gets 15% of the blood flow from the heart. So the brain can be affected by high blood pressure, high cholesterol, diabetes, and obesity. CBS's chief medical correspondent, Dr. John LaPook, explained on CBS Mornings Plus how healthy blood vessels in the heart and head may lower the risk of dementia and Alzheimer's.
A lot of people who have Alzheimer's also have a vascular component.
People with Alzheimer's also have a smaller hippocampus. That's the part of the brain that makes memories. But there's one group of people whose hippocampi, the plural version of the word, stay big, lowering their risk of Alzheimer's. Those folks are London cab drivers. As CBS's Chapman Bell explains, scientists are mapping out their brains.
Weaving through the streets of London, black cabs and their drivers help make up the fabric of the city.
I love my job, 25 years, and I still love it. Very proud of it.
Scientists now believe these world-renowned drivers could deliver more than a pleasant journey. To get behind the wheel of one of these famous taxis, drivers must first pass an exam called the Knowledge.
Turnpike Lane Station.
Spending years memorizing hundreds of routes around more than 26,000 streets in the capital.
We will beat a sat-nav, hands down.
By shunning sat-navs and other navigational tools and relying only on brain power and memory, researchers say cabbies may be getting a profound health benefit.
What scientists have found is that the longer they've been working, the larger the posterior hippocampus becomes. But unfortunately in Alzheimer's disease, that bit of the brain actually is one of the first to start getting smaller and smaller.
Experts say that area of the brain is responsible for memory and navigation.
So it may be that the kind of skills these taxi drivers build offset them against Alzheimer's disease. If we can learn from the taxi drivers how they do this, we might be able to find ways to improve people's brain function and avoid the burden of Alzheimer's disease in the future.
The cabbie's contribution giving hope to those suffering. Chapman Bell, CBS News, London.
Coming up, the most important word to know if you're a parent suffering from burnout. And we comb through the facts about stress and gray hair. Welcome back. February is Black History Month, and our next story focuses on a common genetic blood disorder that primarily affects people of African descent, sickle cell anemia. Treatments depend on blood donations from black people, and there's a big push from the American Red Cross to increase those donations. Here's CBS's Stephanie Stahl.
It's a rush to get to work for Commer Williams and her 13-year-old son Cameron. He's in 7th grade. She's in graduate school. He admires athletes and is one himself.
I play basketball, football, and I run track for my school.
He also has sickle cell disease, a blood disorder that mainly impacts black people.
Really painful, and I couldn't do a lot of stuff that I wanted to do.
It's a special challenge for Mom, who's a nurse.
So I see it often, but it's a different level of pain when it's your child.
The main treatment for sickle cell is blood transfusions.
Blood donors who are Black or African American are almost 3 times more likely to be a match.
Denise Anderson with the Red Cross says there are special blood drives aimed at getting more Black donors.
It's estimated that individuals with sickle cell disease may require as many as 100 units of blood annually. And that's why the blood donations is key.
It's not often that we even get this type of platform to talk about sickle cell or the African American community.
It's about ensuring treatments for her son and others, aiming to ease the difficulties sickle cell patients face. Stephanie Stahl, CBS News, Philadelphia.
The next story is for all the parents out there who are feeling stressed and exhausted. One report found more than half of parents say they feel burned out. Another survey found 66% say the demands of parenthood make them feel isolated and lonely. It's a problem big enough that former U.S. Surgeon General Vivek Murthy has called parental stress an urgent public health issue. Grace Bastidas, the editor-in-chief at Parents, joined the CBS Mornings Plus team to offer some tips to prevent burnout. She says this generation of parents feels pressure to constantly engage, entertain, and educate their kids. And then they often feel they aren't parenting the right way or enough. A feeling that's fueled by social media and some parents whose posts are perhaps idealized. She recommends if you have a partner, sharing the mental load. That includes divvying up responsibilities, creating a shared family calendar, and not being afraid to use the word no.
It's no to everything. You have to weigh what you can do, what's realistic. If they're asking you to bring in cupcakes, don't make them from scratch.
No.
Go buy them. You can say no. You can find different ways and you can outsource certain things. So it's just kind of being in the moment, not feeling that pressure or that guilt that you should be doing X, Y, or Z.
Whether it's from parenting or life in general, stress plays a huge role on our bodies. But can it turn your hair gray? That's what many have long assumed. CBS's Jeff Wagner got to the root of that question.
Like a blanket of snow in February, a topping of white is inevitable from the landscape to our heads.
It was kind of an overnight thing where it really went gray on me, so that was kind of a shock.
When did you start to notice you had some gray hair?
I think when my son became a toddler.
There's a correlation there, maybe?
I think so.
For most of us, yeah, it's sort of just gonna happen.
Dr. Sarah Hilwa is a dermatologist with Hennepin Healthcare. Why does hair turn gray?
Well, gray hair is part of the normal aging process, and it basically is when the pigment, like we have pigment in our skin, we have pigment in our hair, we lose the pigment cells and pigment granules.
Pigment gives our hair color. We lose it as we age, turning hair gray and eventually white, which is our hair's natural color without pigment. Is there a typical age range when it starts?
So in people of European ancestry, it starts earlier, so usually in the mid-30s.
I think I was about 35 when it really started to come in.
People of African ancestry is usually in the mid-40s. People of Asian ancestry is usually somewhere in between.
Do you think there's other factors that can speed it up or make it happen sooner?
I'm sure there is. I've heard that stress can do it. I don't know if that's true or not, but
I think so.
Presidential pictures at the beginning and end of a term often highlight the salt and pepper side effect of a stressful job.
So similar to other stressors on the body like smoking and all of that, emotional or psychological stress also increases aging.
Stress causes a chemical reaction that decreases the amount of pigment made, meaning less coloring for hair.
Things that increase this oxidative stress are like UV damage, smoking, chronic illnesses.
So if you want to try to slow the graying process, reduce your stress. Do so with exercise, getting enough sleep, eating a nutrient-rich diet, not smoking, and protecting your hair from UV rays.
There's some low quality evidence that vitamin B5 could be helpful to slow or reverse pigmentation, but that's about as good as we've got right now.
Gray hair might happen sooner. For me, it was 15, at least the first hair. Or accumulate faster for certain people, but we all eventually meet at the finish line with a silver medal of sorts.
I've earned it.
Yeah, exactly. That's a good way to put it. You've earned it. Good for you. Jeff Wagner, CBS News, Minneapolis.
Coming up, a Massachusetts teenager who got CPR in a time of need is now paying it forward. And a Tennessee woman helps her former high school teacher become a mother. Welcome back. This Heart Health Month could be a great time to learn or get a refresher on how to do CPR. Companies sometimes offer courses to their employees or low-cost training is available. A Massachusetts teenager who is alive today because of CPR has made it her mission to teach others. CBS's Julie McDonald has her story.
And now they're lying there unresponsive. So what do you do first?
Madeline Jackman brings unique perspective when she teaches CPR. She's well trained in the techniques, and she really cares about the person this mannequin represents. She was that person, terrified and in desperate need of help.
When I was 8 years old, I was out for dinner and then I started choking on steak. And no one in my family knew CPR or the Heimlich, and no one could help me. Luckily, there was someone at the restaurant who was a nurse and knew CPR and saved my life.
Now, Madeline wants to be that for others. She started the Red Cross Club at school, and their Heart Starters program provides free CPR training to restaurants all across their community.
Clear. So I've worked at restaurants where people have either choked or passed out from heat exhaustion or just been overwhelmed and needed to sit down, and having the actual tools in my tool belt now to be able to assess the situation and see if someone needs help.
So if you can get them straight into that position.
The students have fundraised and secured generous donations from local businesses so that the training is free, making it more accessible.
It brings the community together in many ways because we're all more prepared for an emergency. The more people that know, the better.
I'm so proud of everyone who's committed to this. It's just so amazing to see how this little idea grew.
A little idea, now a life-saving lesson, and a gift to her community, the value of which can't be measured.
So that just in case, we can always take the best care of our coworkers and our customers.
Julie McDonald, CBS News, Newburyport, Massachusetts.
Finally, this half hour, a growing number of Americans are turning to surrogates to have a baby. The most recent federal data finds more than 98,000 babies were born via surrogacy in 2022. CBS's Steve Hartman traveled to Duck River, Tennessee to meet a family made possible thanks to an incredible gift.
For as long as they've been married, Ashley and Spencer Toddy of Duck River, Tennessee have dreamed of raising more than just cows.
Come on, come on.
The 35-year-old former high school teacher and her utility lineman husband both really wanted a family.
I've always wanted to be a mom, and we were diagnosed with unexplained infertility, and we still don't know why.
They had 5 miscarriages. IVF treatments didn't work, and the dream faded.
And that's when Ashley got a message. Now, she believes it was sent from God, but it came through Facebook Messenger. A note from a former student from long ago who'd heard what Ashley and Spencer were going through.
The note read, "If you ever need a surrogate, I'd love to help you become a mom." I hope this isn't weird.
Completely out of the blue.
Out of the blue.
I was like, you know what, at this point, nothing is crazy to me.
27-year-old Hannah Dearman, a mother of 3,
You want some apple?
remembers her old teacher vividly.
She was just so loving and kind, and she's caring. She has a great personality.
So, even though she'd hardly even seen Ashley since graduation, Hannah offered to carry her baby for free.
I needed to fulfill this.
Sophie Lee Toddy is now 7 months old and as happy as they come. A bubbly bundle of proof that good begets good. And often, miracles come to those who deserve them most.
It reassures me that there's a tremendous amount of positivity in the world.
She is so selfless. She's an angel on earth.
Over the years, a lot of teachers have been gifted apples.
Go sit.
But only this one got the apple of her eye. Steve Hartman in Duck River, Tennessee.
A lesson about life and love. That's Ion Health for this week. I'm Bradley Blackburn. Thanks for joining us, and be well.